I'm Christina, and it is time for a critical review. This review is based off of a true story and a novel based on an acclaimed bestseller written by Susanna Cahalan. In 2009, Susanna Cahalan was a young and vibrant 24-year-old journalist for the New York Post. Beautiful girl and happy in love, and had the whole world at her fingertips. During a normal workday at the New York Times, everything changed for her. Very suddenly, her world turned upside down, and when she began to exhibit out-of-character behavior, she worried her loved ones with manic episodes and scary symptoms such as psychosis, hallucinations, anger outbursts, and terrifying seizures. Susanna would fall into a catatonic state without even realizing her true surroundings. During these episodes, her behavior was very unknown and quickly became a desperate situation. After the third seizure at home, her parents demanded that she go to the hospital. Shockingly, all of her tests came back normal, including an MRI, which is a fancy scan of your brain. Besides the obvious troubles, anxieties heightened when doctors were puzzled by her mysterious illness. The doctor suggested that she admitted into a mental facility where she would not receive medical treatment, but more psychological treatment to help guide her through a new diagnosis of bipolar and schizophrenia. No one was at peace with this diagnosis. The parents were not having it at all and demanded further testing and more time. They had to be missing something. One of her doctors was so perplexed that she went to her mentor with questions. After some reluctancy, Dr. Sahel Najjar agreed to visit Susanna in the hospital, but with no promises that he could help. Fortunately, Cahalan found her answer thanks to Dr. Najjar, who diagnosed her with anti-NMDA receptor encephalitis. This film was not far off with the misdiagnosis because this disease mimics psychiatric symptoms such as depression, mood, and anxiety, seizures, movement disorder. But there is a high risk of overlooking NMDAR in patients with pre-existing psychiatric illness due to symptoms that overlap. Sadly, it's very possible that many people struggling with a mental illness could actually have anti-NMDA receptor antibodies. Not because it's a ghost disease, but lack of testing from the doctors. Unlike the movie, the detection of anti-NMDA receptor antibodies is easily diagnosed, whether that be from blood work, MRI, or fluid samples. This typically leads to a diagnostic clarification. Typically, these tests will show any abnormalities. This is according to a study by the National Institute of Neurology in Mexico. Catatonia in patients is very common, and this is the part that really interested me. She would fall into these catatonic states or a trance, really, because she had zero recollection of any of it. I looked more into it, and according to an article by the National Institute of Neurology and Neurosurgery in Mexico, a prospective study was done with all inpatients who fulfilled the criteria. The Bush-Francis rating scale was used, and 58 patients were included, and catatonia was diagnosed in 41 of the patients. That is 70% of the patients. This included immobility, staring, delusions, hallucination, which are exactly how the movie Brain on Fire depicted it. So they did do a good job with the symptoms. But after the proper diagnosis, approximately 6 months after the steroid pulse treatment she received, Susanna was completely free of symptoms. Although this is great news, according to an article written from Metro South Addiction and Mental Health Services, it focused on care for someone recovering from this disease. That is aftercare. One thing that this movie does not mention is the psychological recovery that is needed to take place, even along with physical recovery. The Journal of Neuropsychiatry and Clinical Neurosciences stresses the importance of therapy because PTSD from this experience is very likely to develop.